Where is the vaccine at? I mean, because apparently the whole world is on hold. We're all going to wear masks. We're going to not have debates. We're going to destroy our political system. We're not going to go into voting booths until we have a vaccine. So how's the vaccine doing?
Yeah, so let's talk about Moderna because the last couple of weeks we've been doing AstraZeneca's because of the transverse
Yeah.
myelitis. So Moderna is now taking the headlines. It's all over the news. And let's look at a Forbes article. We'll take it right from the headlines. Now,
Okay.
this is an article from a man named William Hasseldine. It's COVID-19 vaccine protocols reveal that trials are designed to succeed. Now, Hasseldine, for nearly 2 decades, was a professor at Harvard Medical School, Harvard School of Public Health. He founded 2 academic research departments. This is not a guy whose opinion we should take lightly. This guy knows what he's doing. So let's look at the quotes
And
from
of course,
this.
he's
I have
referencing the fact that they did release the protocols, right, for transparency under,
yes.
AstraZeneca. We're really wondering how the trial's working, how you discovered the transverse myelitis. So there's been this sort of like, here's the protocols, here's how our trials are working. So what did he discover when he looked into it?
Absolutely. So he discovered from the first quote here, prevention of infection is not a criterion for success for any of these vaccines. 3 of the vaccine protocols, Moderna, Pfizer, and AstraZeneca, do not require that their vaccine prevent serious disease, only that they prevent moderate symptoms, which may be as mild as a cold, cough, or headache. He goes on to say, the second surprise from these protocols is how mild the requirement for contracted COVID-19 symptoms are. A careful reading reveals that the minimum qualification for a case of COVID-19 is a positive PCR test and 1 or 2 mild symptoms. These include headache, fever, cough, mild nausea. This is far from adequate. The vaccine trials are testing to prevent common cold symptoms. That's
Wow.
really what's going on here. And then finally, he finishes off by saying these protocols do not emphasize the most important ramifications of COVID-19 that people are most interested in preventing: overall infection, hospitalization, death. It boggles the mind and defies common sense that the National Institutes of Health, the Centers for Disease Control, the National Institutes of Allergy and Infectious Disease, and the rest of the world consider the approval of a vaccine that would be distributed to hundreds of millions on such slender threads of success. Powerful words.
Amazing that, on one hand, the news is scaring us to death of this virus. Donald Trump is putting the world at risk by not wearing his mask and working in the Oval Office. And meanwhile, the savior, the vaccine unicorn I have been describing, right? We all remember the vaccine unicorn, that mythological entity out there that's going to save us all from COVID-19. Well, as it turns out, they're willing to accept it. I predicted this, didn't I? I said, what if the vaccine unicorn ends up looking like this? That is it. What we've got now is a chihuahua with a cone on its head. Because clearly, right, if you can't stop the death and you can't stop the infection, and now they're saying it won't stop transmission, what are we doing here? I mean, this is absolutely insane that we are continuing to lock down, wear masks, as though somehow hiding from this virus, we were supposed to be hiding to flatten the curve. Then it's hide to wait for the vaccine. Now the vaccine can only help those that maybe just have a cough or some light symptoms. The rest of you that are about to die, totally useless for you. That's really outrageous. And one of the things, when we were talking about this article, that I sort of want to bring up is we're hearing about these trials being 30,000 people, right? And we're all thinking, wow, that's a robust safety trial, 30,000 people, or an efficacy trial. What he pointed out in this article was the fact that that's really just how many fishing lines have been thrown in the water, that they're going to make all of their decisions based on somewhere between 75 and 150 people that end up being infected, whether they're in the placebo group or in the vaccine group. The study really is going to be a study of 150 people. The 30,000 was just trying to find 150 infections. Did I read that right?
Yeah, something around that number of 153, I believe.
Yeah. I mean,
Yeah.
outrageous. So the trick of the numbers, right? We're all going to think, well, I mean, the study of 30,000 people showed that it was safe. No. It's going to end up being a study of 150 people to see whether or not you had a light cough or a heavy cough, or you had a bad headache or a light headache. That is all they are seeking to achieve, is to reduce your bad headache to a light headache. Which
Yeah.
are we seeing any signs that the vaccines can even do that?
Uh, Actually, we're seeing some signs that the adverse events can cause that,
Oh,
and
really?
and that's right out. That's right out of Moderna's trials. So this is a headline out of CNBC, and it's talking about coronavirus trial participants are seeing exhaustion, fever, headaches, and this is. I'm going to go through this article because these are some quotes that have to be put on record. So the first quote from this, I think, is so very important. It just basically describes someone. They talked to 5 people. It describes their journey through this. After getting the first shot on August 18th, he said he felt a little under the weather for several days with a low-grade fever. He got his second shot at the clinic on September 15th. 8 hours later, he said he was bedbound with a fever of over 101, shakes, chills, a pounding headache, and shortness of breath. He said the pain in his arm where he received the shot felt like a goose egg on my shoulder. He hardly slept that night, recording that his temperature was higher than 100 degrees for 5 hours. Now it goes on. This is another participant. Says if this proves to work, the vaccine, people are going to have to toughen up, she said. The first dose is no big deal, and then the second dose will definitely put you down for a day for sure. You will need to take a day off of work after the second dose. And then the final quote, this one just blew me away when I read this. Another participant in Pfizer's trial said he was up all night after the first shot from the pain of the injection. The booster injection he received caused more of that same pain in his arm, followed by intense flu-like symptoms that hit him around 1 a.m. He couldn't sleep that night without an electric blanket and shook so hard that it became uncomfortable, and he cracked part of his tooth from chattering them. It hurt to even just lay in my bed sheets, he said, before he decided to see a doctor. And this is talking about Moderna and Pfizer's participants. So they were talking about both of them there. Just fascinating descriptions.
Those are horrifying descriptions. In fact, worse than, I would say, 80 to 90% of the population that currently have got to take a test to discover whether or not they have COVID-19. I mean, we're talking about an illness with some of the lowest symptoms known to man, and just based on that trial we've talked about a lot, they're saying, well, they're just seeking to reduce your symptoms. How do you reduce your symptoms below 0? It appears that most people in the world have 0 symptoms, and yet we're the ones that are going to have to get this vaccine. Probably not those in the high-risk group, because they already know the vaccine doesn't show to have any effect on them, which is the only reason we needed a vaccine. It's the only thing that makes this maybe not a cold, right? If this is just a regular cold, the one group that's maybe experiencing something a little bit more dramatic than a cold, these vaccines aren't going to prove to do anything for them. And the rest of us, I mean, now we find out I'm going to be more sick. That one woman, I think that second quote was really powerful, which said, you're going to just have to get ready for that second shot, take a day off of work, because you are going to be really sick for an entire day. Who wants to sign up for that when I don't know anybody around me that's doing anything but testing positive, having had no symptoms at all?
Yeah, and to be fair with this reporting, all of the participants that were quoted in the article did say that they hope people take the vaccine, that they hope this doesn't have any issues with people taking it. They just wanted to tell their story and perhaps let Moderna or Pfizer know that they should prepare people a little more before they get these shots. One of the participants decided not to use their name because in the article it said that they were afraid what the company might do to them. So that was an interesting little point. But
right.
The Moderna's vaccine rolled out in older adults. Now, this is a final thing. It was published in the New England Journal of Medicine.
Okay.
And Fox News reported on that. And they claim that they're showing efficacy in older adults. So now we're getting towards Moderna says coronavirus vaccine boosts immune system response in older adults. This is more of the people that would be affected by this COVID-19 as opposed to the young, healthy 18-year-olds or whoever. So looking at this study, I pulled out a couple of things that I thought really came up. Now, this is the study Safety and Immunogenicity of SARS-CoV-2 mRNA 1273 vaccine in older adults. Now, it says in there, quote, because of clinically significant systemic retrogenicity observed in participants between ages of 18 and 55 in the 20 milligram dose, we administered doses of 25 and 100 to the older participants. So here we already have
so they had a 250 dose, and now they've micrograms. So 250 micrograms, I guess, is what that is, and that's being dropped. Can we bring up that just so I can see it again? So the 18 to 55, because it was such a systemic reaction, obviously a powerful reaction, and somewhat alarming, they've dropped the dose to 25 and 100. Significant drop, less than half, and in one case, 1/10 of what the original dose was for the older participants, the one that needed it most, the ones whose immune systems are probably weaker than everybody else. I would guess they should be going the other direction. But what did they discover with the lower dose? Did it make it safer?
Yeah, well, the other thing that they didn't do, they didn't screen the participants for the infection. So in that quote, that final piece, it said they didn't screen for evidence of past or current SARS-CoV-2 infection by testing the blood or nasal specimens. So there's another issue. But let's look at the chart from this study. Now, the chart shows that on the right side, all of those little bar graphs on the right side, that was the second dose of the vaccine. So you can see a lot more bars there, which signify adverse reactions. Now, the ones that were really high, 40% to almost 100% in some of the categories, were fatigue, myalgia, headache, pain at the injection site, systemic reactions, and some of those were moderate. A couple of them were severe. So you're seeing, just like with the other dosages of the people that were complaining in the Moderna trials from the earlier article, you're seeing that second shot is the shot that seems to be really adding. Yep, that's the doozy.
Wow. Well, that's really alarming information, that what we're all waiting for is an ineffective vaccine that might possibly, if we're lucky, just reduce mild cold symptoms, but will give you severe flu-like symptoms that can lead to shattering of your teeth. Best case scenario. I don't know, man. I think this thing's dead in the water, and I don't care what Donald Trump has to say about rushing this vaccine out. It seems to me that there's good reason this thing is going to take a while. If you like that clip, then be sure to check out our live broadcast of The High Wire every Thursday morning at 11 a.m. Pacific Time. You can watch it on Facebook, iTunes, and Twitter. We'll see you there.